Hello, everyone. So I'm Sharon West. Thank you. So what an honor it is to come, and I've been looking forward to this. I've been on the road so much over the last couple of months, and but I've so looked forward to this time, and I want to say a couple of thank yous before I get started. So thank you to Buncombe County for even hosting such an event like this over the last 4 months. So yes, definitely. So that they know, they're aware that we need this information because you don't know what you don't know. Is that right? The other thing is, so I'd like to thank Dr. Charles Blair. How many of you knew Dr. Charles Blair? Dr. Charles Blair was an African-American physician in this area. He is now deceased, but he was a great contributor to my life. He was a mentor and introduced me to the words health disparities, which even though I was a nurse and after 20 plus years, I still didn't know that much about it, but he shared that we have it here in Asheville. So kudos to Dr. Blair. I love you. I know he's looking down on this because he's passed the mantle for us to continue the work. And then I like to say, my mom is here. Yay! Woo-woo! I said, Mama, when I say your name, you make sure you wave. And she's like, okay, I'm ready. So anyway, without further delay, I want to get started. Now, I want to know if people in the back, can you see the screen okay? Please feel free to move up to the front. I promise I won't ask you any questions. There's not going to be a test. Well, maybe. That's still in consideration. But anyway, let's get started. So if you look at the title of this, it's really rather long, but it says Healthcare Access and Availability and Outcomes for the Black Community of Asheville, 1890 and Beyond. So why'd I even do such a study as this? Well, when I was a nurse manager of oncology services at Mission Hospital years ago, I became interested in knowing about the Asheville Colored Hospital. My grandmother used to tell me about the Asheville Colored Hospital, but when I wanted to find information on it, I could not. It was very limited information. And so in my quest for knowledge about the Asheville Colored Hospital, why was there a need for a colored hospital back then? Where did Black people go for health care? Who were the doctors? All that. That quest for knowledge for the Asheville Colored Hospital information expanded into being introduced to some of the most phenomenal physicians and also reinforced with me the resiliency of the Black people in our community during those early years that had very limited access. So, hence the title. We can't really talk about this without talking about slavery, right? So we need to address that issue, mainly because I remember Dr. Blair sharing with me, can you all hear me okay back there in the back? Okay. I remember Dr. Blair sharing with me years ago, many years ago, that during slavery, Black people were the healthiest we've pretty much ever been, was during slavery. So you probably wonder, well, why? I mean, how can that be? I mean, what are you talking about? I mean, how can that be? Well, just to give you a brief history lesson, you know this, I'm sure, but let's talk about it, is that slavery was about economics, is that right? So the healthier the person was, the more they could produce, and the more they could produce kept the revenue flowing for that slave owner, right? So when slavery was abolished in 1865, there was no longer a vested interest to keep these people who are now free well, because I can't benefit from it. So we're going to talk a little bit more about that later too. But also during the Reconstruction period, and I'm sure Dr. Waters mentioned a lot of this during his excellent presentation, I'm sure. And also the folks that have come before me, I know the heavy hitters that have come before me with wonderful presentations. So I know you've been enjoying this whole series, for those of you who've been to every one. But during the Reconstruction period, that was an attempt to make the wrongs right. it was an attempt to say, let's provide resources to these people, all Americans, but to people in general, so we can help them to be fruitful, we can help them to flourish, we can help them to be civilian and feel welcomed and engaged, so to speak, after such a traumatic thing as slavery. So during the Reconstruction period, the Freedmen's Bureau came into existence. The government put money in and said, we're going to create this bureau, and what this bureau would do is to provide resources for freed men, former slaves, so that they could know how to support their families. Well, it's really interesting that those people who were once enslaved really didn't know how to function after so many years having folks to provide food, housing, clothing. Yes, they took advantage of it, but there were some who decided to stay where they were, even though they were not slaves anymore. They decided to stay with their plantation owner because of that security that was there. But because so many people did not have the resources to be successful as citizens, then the Freedmen's Bureau wanted to provide as best as possible income and resources to help them. So during the Freedmen's Bureau also, doctors were educated. Men were sent to become medical doctors. Black men were sent to become medical doctors so that they can now care for the black community. Because remember, the health decline, slavery's over, and black people were dying. As a matter of fact, this is one statistic. The health decline of black people post-slavery during this period, this Reconstruction period, et cetera, was so bad that it was predicted that by the year 2000, all black people would be extinct. So 1890, Asheville, North Carolina, let's bring it home. In 1890, Dr. Marcus Austin is the first physician to come to Asheville. Dr. Austin graduated from medical school at Leonard Medical School, which is a part of Shaw University. It closed down in 1940, but this is where he graduated from. What was so interesting is that in 1895, throughout the country, remember this funding that provided training for black men to become physicians? In 1895, across the country, there were 385 black physicians that were doing exactly what Dr. Austin came to Asheville to do. How he decided on Asheville, nobody really knows. There's not a lot of information about Dr. Austin, but we know that he left in 1901. So he had a pretty significant stay here, but compared to the others who came after him who stayed like 20, 30 years, it was a short stint for him. And from what I understand, from the information I could find, he left pretty quickly from Asheville. So we don't know the circumstances behind that, but he is acknowledged as being our first physician to come into Asheville. In 1907, Dr. William G. Torrance comes to Asheville. Dr. Torrance was a graduate also of Leonard Medical School, and Dr. Torrance was a visionary. What made Dr. Torrance a visionary? This is a man that I love talking about because Dr. Torrance realized that there were no hospitalization options for black people in Asheville during that time. So what he did was to create the Torrance Hospital, which was the first hospital available for treatment for blacks in Asheville in 1913. Originally, it was located at 16 Eagle Street. If you know where the barbershops are located on Eagle Street now, it was located across the street in that building called the Wilson Building, and we're going to talk a little bit more about that later. But then he moved it from 16 Eagle Street to 95 Hill Street. Now, if you're looking at Isaac Dixon School, facing Isaac Dixon School, and to the right there's a hill on the upper part. That was the location of Torrance Hospital, all right? Up until about 5 years ago, the steps leading up to the hospital were still present, but now they've cleared a lot of that off. Here's a picture, an actual picture of the Torrance Hospital years ago. So if you see the steps leading up, the family of Dr. Torrance lived on the first floor, And the patients who he had hospitalized were on the second floor. There were about 3 bedrooms, we assume, that was a part of that second floor level. So the wife did the cooking and preparation, and Dr. Torrance could only care and admit his patients. So it was minimal access, but still, this was the first hospitalization option for patients that needed 24-hour day care, the Torrance Hospital. Here's an ad that I found of the Torrance Hospital, which I thought was really interesting. If you can see here, it says, this is the Torrance Hospital, Hospital and Residence, 95 Hill Street, the telephone number, and then his office at the YMI, Young Men's Institute, which we now know as the YMI Cultural Center, but his office was at the YMI, hours 3 p.m. to 6 p.m., and then by appointment. And I'm thinking, based on pictures that I've seen of Dr. Torrance, this is Dr. Torrance here. But guess what? It opens in 1913, and then it closes in 1915. Dr. Torrance is dead at age 34. Dr. Torrance died in 1915 from pulmonary tuberculosis, which was quite common during that time. Dr. Torrance also worked with this gentleman. It takes skill to do this, ladies. I just want to let you know that. J.W. Walker, where the area is right here, J.W. Walker signed the death certificate for Dr. Torrance. Dr. Torrance worked as a consultant for Dr. J.W. Walker at the Circle Terrace Sanatorium. The Circle Terrace Sanatorium was located on Circle Street here in Asheville, which is not far from here. As a matter of fact, when you go out, make a left, you see Calvary Presbyterian Church, that's Circle Street. So the Circle Terrace Sanatorium was located in this exact area. So Dr. Torrance was a consultant, and probably is where he contracted this pulmonary tuberculosis. But let me tell you something about Dr. J.W. Walker. John Wakefield Walker is also the uncle of Dr. John Plummer Holt. If you remember Dr. Holt, who served our community for many, many years. So this is his uncle. Just to give you an idea, 1915 to 1922, now there are 6 black physicians caring for black patients in Asheville, North Carolina. In the country in 1915, 1916, there are 1,400 black doctors serving people, black people in communities like Asheville across the country. So where are the offices located of these black physicians that are serving, that are coming in? Well, the YMI, which we talked about, the Wilson building, which is the building I told you is across from the barbershops, up and down Eagle Street. Ashland Avenue had quite a few physician offices there. This is a picture of the Wilson building. It's now the location of Le Monet's restaurant. That's the Wilson building if you ever pass by there. So these are where a lot of the doctors' offices were located back in the day as well. Here's an older picture of the YMI, which we now call the YMI Culture Center. And in the middle here is Dr. L.O. Miller. Dr. L.O. Miller is responsible for this wonderful treatment of high blood pressure in his patients, in his African-American patients, and had quite the success with that. But as you can see also, there is a pharmacy. So this is where black people would see their physicians here throughout, and then they would come right here and get their medicines filled, okay? So very convenient. Here's some information about the Circle Terrace Sanatorium. So this is what I love, because it says, this is believed to be the only institution in the world for the exclusive treatment and care of tuberculosis for colored people. So it boasts of electric lights, call bells, telephone, baths, and you know, coming to Asheville was the ideal area because of the elevation, the climate. It was good for people who had any respiratory conditions anyway. But this is the only one in the country that has been identified in the country as being to serve black people. And it was considered state of art. But see, here you have J.W. Walker, physician in charge, and here's Dr. Torrance as a consultant. All right. So it's 7 years now. The Torrance Hospital has closed. It's 7 years before there are any other hospitalization options for Black people in Asheville. But in 1922, a group of Blacks and whites come together. They realize there's a need because Black people have no hospitalization options. So then they open the Blue Ridge Hospital in 1922. It was originally located on Burton Street, and later it located to 18 Clingman Avenue. And I'm thinking, if you know where Citizens Fuel is on the corner of Clingman, and then where Mountain Housing Office Building is, it was somewhere in that vicinity, Blue Ridge Hospital. So it's purchased by a group of Blacks and whites who work together, a collaborative, because of the need for the people, which I think is very good. It had an operating room. Torrance Hospital did not have an operating room, but it had an operating room for minor procedures. And then there was the first training school for Black nurses that was there. It was 5,460 square feet. So it's pretty big. Now Black doctors have admitting privileges for their patients. All the Black doctors that could admit their patients here for care for the first time. This is a picture of the Blue Ridge Hospital. So it's not very fancy, but you can tell it's pretty spacious. Here's the first graduating class of nurses here. And I said, this one must have to work night shift. She's not smiling. She's not real happy. And this is Miss Woodbury. Now look, I've been in nursing a long time, and we know strict nursing supervisor. I'm thinking that's one of them right there, okay? Don't mess with that hat, right? Don't mess with that cap. 1929, guess what? 7 years. What is it about this 6-7 year span, you know? 7 years later, it closes. What's going on in June 1929 in America? The Depression. Remember these people that were contributing money because they believed in having hospital access for African Americans of Asheville. Remember all the whites and the Blacks coming together and contributing? The money dried up. People couldn't hardly take care of themselves. The health of African Americans in Asheville, all over the country, declined. The health of all Americans declined because of lack of access. It was a very, very bad time. Now in Asheville, though, so here again, we have no hospitalization options once again, but you have 8 Black physicians practicing general medicine with very strong practices. So what are they doing? They're seeing their patients in their offices at the Wymount, Ashland, wherever their office was. They're going into the homes to see their patients. You know, this is what it was. I mean, it is what it is. This is what it was. And there was a lot of folk medicine, herbal remedies that were used and still used today, but people had to do what they had to do and what needed to do to survive, okay? No hospitalization for Blacks. Dr. Polly Shuford, we're going to talk about her. She's my hero. Dr. Polly Shuford talked about Black doctors practicing medicine without hospitalization options for their patients. She was interviewed in 1975 talking about the 1930s and 40s, right after the Depression. And she said the situation in Asheville was so bad for the colored people that something had to be done about it. They just didn't have hospital beds for them. They couldn't get in the hospital, and they couldn't have surgery. No hospitalization options. This is Dr. Polly Shuford. Oh, where's that thing? There it is. This is Dr. Polly Shuford here. You can tell she means business, right? Yeah, she means business. So why was Dr. Shuford so encouraged to be an advocate for Black people? What was the bottom line to her interest? What was the connection? When she was in medical school, she received some news that a lady that helped reared her nanny or the maid or the cook, whomever this lady was when she was growing up, died suddenly. And she knew that this woman should not have died because what she died from, whatever that was curable. But here again, because of this lack of access, she knew that she had to take a stand and be an advocate for people. So after she graduated from medical school, she came right back to Asheville to work. 1939, Dr. Shuford becomes a true advocate, and she said, look, you know, we need something to happen for these people. So in her family home, her parents are now deceased. In her family home, she opens one room of her family home and makes it a one-room hospital to care for black people. So you can imagine, now we got a lot of black people, and then we'll talk about that number, but she did what she could with what she had, and she was willing to open her doors to do that. So it was a one-room hospital in the family home. Anna, who was her housekeeper, was trained to be her assistant or her nurse, you know, how to take a bandage off, how to put it on, how to take her temperature, those kind of things like that, and Anna did it. But some of her, Dr. Shuford's colleagues in Asheville, white physicians, said, we want to help, and we know that they can't pay us, but I tell you what, Anna makes great blackberry wine and pound cake. So if she can make me a pound cake, then I'm in, you know? So that's the arrangement, because people didn't have money to pay for the services that were being rendered at that time. So they essentially donated their time to care. In 1940, this is what the statistics look like in Asheville. 52,000 people residing in Asheville, and of that 52,000, 15,000 are African Americans living in Asheville, North Carolina. Here's a little slide about hospital bed availability for blacks in Asheville, 1940. There are 400 beds, general, for anyone, 400 beds in Asheville between 5 hospitals, 5 small hospitals in 1940. 5 hospitals, 400 beds, right? So there are 18 beds that black people can occupy. What is the population of Asheville during that time? 15,000 thereabouts. Actually, in 1942, it dropped to like 12,000. But let's say that 15,000 number, but still, there are 18 beds that black people could occupy. But guess what? These are not beds that black people can have. These are indigent beds. So if you have a white person who is poor, that needs to be hospitalized, they get that bed over the black person that needs to be hospitalized in 1940. So in 1941, there's this physician that is like Dr. Shuford, an advocate for care for all people. Dr. Ambler, he was an anesthesiologist in Asheville. Dr. Ambler speaks to the Buncombe County Medical Society, which is now the Western North Carolina Medical Society. But Dr. Ambler speaks and he says, we have a crisis. We have black people in Asheville that are dying unnecessarily. We need hospitalization options for these people. There's no place for them to go. We need doctors to help Dr. Shuford at the clinic. And Buncombe County listens and says, thank you, but that's not a part of our agenda currently. We're so sorry. Have a good day. 1942, Dr. Shuford's talking with one of her patients, and she shares about the plight. Because remember, she's got that one-room hospital now. She's caring for people as best she can. She's running over at the seams. And she's sharing the plight and how Buncombe County Medical Society wouldn't give her any help. And this lady donates to her $15,000, her patient. She was a patient who lived 6 months in Florida and 6 months here in Asheville, and she writes Dr. Shuford a check and say, look, do whatever you need to do to get it done, because she saw the passion in Dr. Shuford. Dr. Shuford then purchases what became known as the Shuford Colored Clinic, located at 269 College Street. How many of you know where David Miller Junior High School was located? That's where I went to junior high school. David Miller Junior High School, if you remember where that is on College Street, this clinic was located across the street. It was like a little frame house that Dr. Shuford converted into a clinic, the Shuford Colored Clinic. And Mr. and Mrs. Ray, Jesse Ray, lived next door in one of their first homes. So she has fond memories of that. But anyway, at the Shuford Colored Clinic, it was a former residence of Dr. John Wakefield Walker. Remember him, that signature on the death certificate? This was his former residence. So they had nurses, they had cooks, they did minor operating procedures. There were 9 beds in this facility. The first year they did 200 operations. They had 2,100 outpatient visits. So Dr. Shuford was pretty busy, you think? She was pretty busy. She's the only one that's doing the majority of the work to care and to do. And now there are 30 beds in the entire city available to blacks. But the black physicians refused to participate. They felt that Dr. Shuford was taking their patients away from them, not looking at the bigger picture. And some of that I can understand, but then you got to look at the bigger picture. You know, are people getting the care that they need? And so, but bottom line, they didn't participate. Late 1943, Dr. Shuford now goes to Buncombe County Medical Society. She says, look, I got this Shuford Color Clinic. I'm working really hard. I don't have anyone to help me. Some doctors will rotate and come through, but I need you all to advocate for doctors to work in the Shuford Color Clinic. We need help. We need resources, you know, because folks can't pay for the services they're getting. Buncombe County says, thank you very much. Have a good day. Denied again. But little did they know that in the audience was a reporter from Asheville Citizen Times, what was called Asheville News at that time, but Asheville Citizen Times, and he wrote everything that they talked about in Buncombe County at the Medical Society meeting, and he put special emphasis on this is the second time that this request has been denied. Now, you got to remember, see, this is what's really unique about the Asheville community, I think, during this period of time. Even though we may have some race relations issues, let me tell you, white folk who had black folk working for them treated the black folk, for the most part, like family. They were really attached to the people that they served. Let me tell you, when I was in high school, I had so many cute clothes. My grandmother worked for a very wealthy white family in Asheville. I had so many cute clothes. I was wearing Papa Gallo shoes when I was in the 7th grade, you know, because they looked at me just like a part of the family. I'm not saying that happened in every case, but a lot of cases. Why do you think these people who read this article in the paper became so outraged to the point that they knew that they needed to fund health care for black people that were working for them and caring for their children to the tune of $22,000 that poured in because of this? So Dr. Shuford takes this money and she opens the Asheville Colored Hospital, along with other doctors and other interested people in Asheville. It was located at 185 Biltmore Avenue. It's a former residence of Dr. RH Bryant. So Dr. RH Bryant was known as the baby doctor. He also is the black doctor that introduced immunizations into the black community. What's really interesting about this residence, but let me ask you this. How many of you are familiar with where Jessie Ray Funeral Home was? Okay, that's 185 Biltmore Avenue. So that building was the Asheville Colored Hospital. How many of you know where Asheville Gastrointestinal, whatever it is, on Biltmore Avenue? If you look across the street now, unfortunately, it's a parking lot. But prior to that was the office of Gene Ellison on Biltmore Avenue. That was the exact location of the Asheville Colored Hospital, okay? So let me tell you about Dr. RH Bryant, the baby doctor. So Dr. Bryant purchased this property years ago, all right? And he went to the city of Asheville and he wanted this property to build a clinic for colored people. The permit was denied. And so the permit was denied for the clinic, but they approved the permit for him to build his personal home there, use it as his personal home. He agreed to do that, but they also said, when you use this as your personal home, you cannot sit on the porch facing Biltmore Avenue. You must sit on the side facing South Lexington. So he wanted it, he built it. Little did he know that his dream would be realized years later, not only a clinic, but a full-fledged hospital to serve black people. So this was a really good situation. Black physicians worked well with the white physicians. White physicians rotated through the Asheville Colored Hospital. Great relationship. The doctors now have admitting privileges again. It's a good situation. It was considered a state-of-the-art hospital, 31 beds, 2 private rooms, no elevators. There were 19 steps in that building. So if people were admitted and had to go to the second floor, then they would be on a gurney and they would have to take them to the second floor. Here's an article that I found about the colored hospital, new colored hospital to open next week. Big news in Asheville, big news. Here's a picture of the Asheville Colored Hospital. And of course, it's very fine, but you can see right there, it says Asheville Colored Hospital. And Jesse Ray Jr. found this photo for me. During this time I was collecting and doing this non-empirical study, Jesse Ray Funeral Home said, look, I got something I want to show you. And he came and he opened his folder and he showed me this picture, and it's like I wanted to cry. I'm like, that's it, that's it. 1948, Asheville Colored Hospital is running over at the seams. More beds are needed. More money is needed to run this operation. It's overcrowded. Uncle Sam is offering money through the Hill-Burton Ad. Hill-Burton Ad was almost like, the time doing the Freedmen's Bureau, and they're trying to help and provide resources. Uncle Sam said, we will provide you money to expand your hospital. We're trying to make some wrongs right. We want to make sure that Black people have access, the colored, the Negroes have access to health care. We will give you federal funds if you expand your hospital, and you will bring Black people under your umbrella in your hospital. But Blacks are to be admitted under equal conditions, no colored only wards. But how many of you know it was separate and unequal? The devil is in the details. There wasn't a lot of oversight of this. So people found all kind of ways to accept the money and just kind of tuck Black people, here and there. It wasn't the best environment because of the little oversight. So now the colored hospitals, the Black hospitals that were in existence at this time, didn't have access to these funds from Hill-Burton. It was only the major hospitals like Mission during that time. And so Asheville Colored Hospital's in a real dire straits here because they have no funds coming in. And I told you it's not looking good. People are coming in, they can't really continue operating as they once could. So now they're having boardroom discussions. Do we expand, try to have some fundraisers? What do we do? Or do we consider moving and merging with Mission, who can get this money? It's good. It's interesting to know that there were quite a few hospitals across the country who refused this money because they said, we will not admit Black people in our hospitals. So there were quite a few that refused. So anyway, 1951, the Asheville Colored Hospital closes, and they merge with Mission. And they merge, and they are placed in the Victoria Ring, which was the location of the Biltmore Hospital. When the Biltmore Hospital closed and it moved to the Mission campus, this is where the Biltmore Hospital was housed, and then they converted that into the Asheville Colored Hospital so the patients could occupy there. It was racially segregated, the Victoria Wing. I'll show you a picture of that shortly. So remember I said, with the Hill-Burton, it says no colored-only wards. Well, it wasn't a colored-only ward. It was a colored-only building on the property that connected to the main hospital of Mission. These are creative ways that people got around that. I remember when I first did this presentation years ago, and Bob Bergen, who was the chief executive officer at Mission at that time, and Bob Bergen said, I want you to know, Sharon, that as if he had to confess to me or something. He said, I want you to know that my first order of business when I became CEO was to make sure that building was demolished, and he did. So here's some of the Black physicians that had admitting privileges at the Victoria Wing, which is a building actually on Mission campus. Dr. Herbert White. Dr. Herbert White's wife, Louise White, remember Miss Louise White, Mommy? Louise White was my 4th grade teacher, and wonderful, I love Ms. White. Dr. Gallego, interesting story here. How many of you are familiar with Hart Funeral Home? in Asheville, Dara Hart, Mrs. Louise Hart, who's now deceased. Dr. Gallego was Ms. Louise Hart's father. So Dr. Gallego is Daryl's grandfather. Dr. Howard Harrison, the late Dr. Vincent, and Dr. John Plummer Holt all rotated through at the Victoria wing of the hospital. So here's a picture of the Victoria wing. This is just a rendering of it. This is the main hospital here. This is the Victoria wing, which is actually the building here. So folks would have procedures over here, then they would bring them through this little connector here and bring them back into the Victoria wing of the hospital. So we've got here separate, but I don't know what's equal. But so this is how they got around it, because they had access to here. So I guess that's where the equal comes in. They justified it some kind of way, I'm sure. And 1954 is when St. Joe accepted its first black patient. You know, when I was doing this research, I was under the impression, when I talked to so many people, that, oh, St. Joe always accepted black people, always. This is what the nuns told me. They said they always accepted black people. And I'm going through the archives, and then I find this. Well, guess what? 1962, Dr. John Plummer Holt is admitted into Buncombe County Medical Society. Love this story, because he was the first black doctor to be admitted into Buncombe County Medical Society. They had a social event, Christmas time at Grove Park Inn. And then Grove Park Inn found out that Dr. Holt is now a member. And then Grove Park said, you all can come here and have your Christmas celebration, but he can't come. Buncombe County Medical Society says, if he can't come, we won't come. And so they didn't. They stood up for it. So hooray for Buncombe County Medical Society. 1964, black physicians can now be accepted as members of the North Carolina Medical Society. See, prior to then, black physicians could only contribute scientifically to the agenda of the North Carolina Medical Society. They could not attend any social events at all. But in 1964, they're fully accepted as members, full members. Dr. Martin Luther King Jr. said, and you're familiar with this, of all the forms of inequality, injustice in health is the most shocking and inhuman. Sometimes we see inhumane, but he actually said it's inhuman because it often results in physical death. This is when he was traveling throughout the country and would see the plight of black people, how the inequities were just so blatant, but there was very little talk about what was going on to black people. Dr. King also said this in 1967, of the good things in life, the Negro has approximately 1/2 of whites. Of the bad, he has twice that of whites. When we turn to the negative experiences of life, the Negro has double share. Sounds familiar? Yeah, we could move that forward really quickly. Well, what you saw was then, 50 years later, what's happening now? I got that quote, that was then. This is now from Michael Jackson when he did the anniversary concert with his brothers. Yeah. So the Institute of Medicine made this statement. I'm going to tell you about this. So the Institute of Medicine said, the historic context shapes the contemporary structure of access for health care. What does that mean exactly? It means that it's almost like the definition of insanity. If you do the same thing and you don't change, but yet you're expecting different results, that's insane, right? So if we have historical footprints of inequities along the way, but yet in 2017, 2016, we're expecting something different, guess what that is? It's insanity. 2000, the year 2000, the United States government said, we're hearing things. We're hearing that people of color are not treated equally when they're going to see their doctors, when they're going to the hospitals, when they're in clinics. They're having to wait longer periods of time. The doctors or nurses are not wanting to touch them. I actually had a patient to tell me that one time when she went to the hospital, that she said they act like they didn't want to touch me. But the Institute of Medicine, the United States Congress is hearing these kind of conversations. They said, in 2000, let's put this to rest. Here's some money. I want you to go across the country, and I want you to dispel these myths. And I want you to come back, and we're going to write it up, and we're going to release it so we can put closure to this, because after all, this is the year 2000. So they wrote this book, 700 pages with testimonials in it. Everybody's waiting for the result. We're ready to put this down. And I have my students to read this because it's such awesome reading. But this is what the snippet of the executive summary says. Racial and ethnic minorities experience a lower quality of health services and are less likely to receive even routine medical procedures than are white Americans. And everyone that they interviewed and the people that made it, their testimonials that made it in this book, were all people who had insurance. They were covered. You have Hispanics, you have American Indian and African Americans. Plus you also have the representation from these same groups from physicians who were experiencing the same type of discriminatory behavior here. So you can get this online. You can read the whole thing online. It's called Unequal Treatment by the Institute of Medicine, no cost, no charge. So what do contemporary structures look like today? Well, if we had to pick a few, there are selective referrals of African Americans for specialists, provider bias, and based on phenotype, how I look and what you think of me. Remember, Institute of Medicine, it says that it doesn't matter who you are, what job you work, how much education you have. If you are African American, American Indian, Hispanic in the United States of America, the chances are pretty great that you're not going to receive equitable care as compared to your white counterpart. Okay? So, infant mortality. That's one of the longest running disparity metrics that we have. It's still very apparent today. And when we look at low and very low birth weights, which is the greater measurement of disparity, premature deaths, early onset of disease, African Americans have a higher chance of morbidity and mortality, meaning the presence of disease at an earlier age and also death at an earlier age. Powers and Fadden, which are sociologists that I studied when I was doing my doctorate, talked about systematic advantage. They get it. They said, how can people expect to be well or whole that when they're born into this country, they're already at an advantage? And there are no support systems in place or very limited to bring them up to a level where they can be whole. Were we ever really accepted as a part of humanity post-slavery? Did that really ever happen? There's a difference between being free and being embraced as a part of humanity. What really happened? So the World Health Organization has one of the best definitions of wellness that I've seen, and that is they define it as a state of physical, mental, and social well-being, not merely the absence of disease. They get it. They get it. It's all of this that makes a person whole. See, if you're physically limited, it's going to affect you mentally and socially. You agree with that? If you're mentally limited, it's going to affect you physically. All of this works together. The World Health Organization gets it. So we have premature deaths in many, many areas affecting African Americans, but look at diabetes, where African Americans in Buncombe County are dying 2 times that of their white counterpart of diabetes complications as a result of diabetes, and the same statistic across the country. Cancer, African American men are dying at 1.8 times that of their white counterpart of prostate cancer. Women, black women, are dying at almost 2 times that or of their white counterpart of breast cancer. Even though black women are not diagnosed as often with breast cancer, they're dying disproportionately to their white counterpart of breast cancer. Heart disease is ravaging the black community. But guess what? No one's winning any races across America, no matter white, black, whatever, in heart disease, because heart disease is affecting 1 out of 4 Americans. But black people are dying disproportionate because of heart disease, because many don't know we even have a diagnosis of heart disease. And infant mortality, which I really prefer to look at infant birth weights rather than infant mortality, but low and very low birth weights equate to probably infant mortality, infant deaths, children under age 1 dying prematurely. Here's some Buncombe County disparity statistics that was taken from the Community Health Report, the assessment that's done I think it's every 5 years. Total cancer deaths, African Americans die 60% more than their white counterparts of total cancer deaths. 50% more African Americans die from diseases of the heart than their white counterpart in Buncombe County. And then if you look at kidney disease, I mean, do you feel like there's a lot of black folk on dialysis affected by kidney disease? 3.4 times the deaths in blacks and whites in Buncombe County, So you hear about social determinants, which I choose to call social contributors of health, but let's say social determinants of health. Have you ever asked yourself, I hear this, but what is it? What are some examples of that? Somebody said, mm-hmm. Who said, mm-hmm? Somebody, what is that? Okay, so when we look at the contributors, 15% can be attributed to social, influences. Environmental, 5%, and these are contributors to premature disease and death. Contributors to premature disease development and death. Health only represents 10%. So even with the Affordable Care Act, it's not going to eliminate disparity. The Affordable Care Act was about access, insurance for all. You can go to the hospital, you can go to the doctor, but there are other issues right here that affects eliminating health and healthcare disparities. And then genetic predisposition, we can't do anything about that. It's how we're born. But behavioral is 40%, those things that we do. Let's look at some examples. This is really small. I was up late a couple of nights ago. I didn't realize it was this small. But trust me on this. So social contributors, 15%. Social, what is social like? What about discrimination, acts of discrimination? What about a history of incarceration? Those people who have a history of incarceration, do you feel like it affects their social access? Yeah, because it kind of stays with them, right? And then education level. Studies show that the lower your education level, the higher the risk of you being incarcerated, but also of stress, disease, all of those things, and ultimately death. Income level, the lower your income, same thing. The higher the risk of premature disease and death. Family support, is the family fragmented? When there's a fragmentation in the family, it affects your social access, what ultimately affects how you function and how you survive. Your values, your culture is all affected there. Adverse childhood experiences, how many children do you encounter every day that is experiencing something violent that they didn't even tell you about? They don't want to tell nobody about. I remember hearing one of my, a friend of one of my children who witnessed his mother being murdered by his father. Another who came home from school who found the mother in the kitchen with a plastic bag over her head where she had been strangled. And he found that. And then we wonder, why are they acting out like this? What's going on? Adverse childhood experience. And what about drug infested and gang infested? All this is violence. And it affects the children. And then work conditions. Are you feeling really accepted or engaged where you spend 40 hours a week working? Or do you feel like you're not included in with everyone else in your work area? And then culture we talked about. What about in behavior? Hopelessness. Dr. Cornel West said, black people have always been hopeful, but never optimistic. Disenfranchised people are not very optimistic. And then self-efficacy. Do we have enough in us as black people to be empowered enough to do what happened in the time of the civil rights era. You know, in the civil rights era, black people were really on top, you know, but we had mouthpieces. We had Dr. King, we had Malcolm X, we had artists singing like Aretha Franklin, young, gifted, and black. We had artists like James Brown singing "Say It Loud, I'm Black and I'm Proud." That instilled that proudness and that sense of belonging. And that was a time, too, where health became closest to parity achievement because of that. The communities working together, people working together, all of that. Self-efficacy and life satisfaction. If I would ask 20 black people on the street, 20 white people on the street today, and this would be a great research project for someone, are you at this point satisfied with your life? Are you satisfied with your life? I pretty much know what the outcome of that would be. And then drug and alcohol, people need to mask what they're feeling through drug and alcohol, sexual promiscuity, lack of physical activity. We talk about a lot of things like if these people in these low-income neighborhoods would just get out and walk, if they eat more healthy fruits and vegetables, then they would be better off. It's not that easy when you're in an area where there may not be any sidewalks. There may not be any green areas. There may not be access to healthy foods in the US of A. And we look at environmental. Do we have environmental disparities in Asheville, do you think? You think we do? So if I look at just a few places, and I don't know, am I okay on time? Huh? I got 10 minutes? Oh, Lord, okay. I'm gonna breeze through this. But anyway, when I look at like Pisgah View and Klondike and Deaver View, one thing I don't identify is a large chain grocery store where people can access fruits and vegetables and all of that, okay? But what I do identify are convenience stores where it's gonna cost a whole lot more money for me to buy fresh fruits and vegetables at a convenience store than at a large chain grocery store. A friend of mine went to a metropolitan city not too long ago, and she wanted some fresh fruit, and she was in this neighborhood, and her cousins in that area said, "Oh, you can buy a gun quicker than you can fresh fruit in this neighborhood." Health represents 10%, and of course, genetic predisposition. I'm gonna move through this pretty quickly, but you can see here are some of the contributors to health disparities. Currently, with 83,000 in Asheville City, as far as our total population, 11,000 African Americans. We have less than 2% African American physicians that's working in Asheville, North Carolina. So it doesn't exactly mirror the population that we serve. So where are we now in the scheme of things? I look at it as a foot of oppression. When we look at how minority groups are portrayed via media, wealth gap, and I know that was discussed at a prior session, incarceration, healthcare, housing, and the puritanical underpinning of all of this is racism. It exists. The elephant in the room, it exists. When you look at the institutionalization of such, what can we do in the area of our policies? You know, expansion, lack of Medicaid expansion. What group of people does this affect the most when we look at these policy areas? Dr. Blair had this, and I call it the Blair approach, call to action towards parity achievement in education. When we know better, we do better. Screenings that BIPA, the Asheville Buncombe Institute of Parity Achievement, is doing, but we need more, we need more. This is all a part of Dr. Blair's model. Recruitment and retention of racial and ethnic minorities to represent the communities that most frequently visit our institutions. Access through community navigators, raise up leaders in the communities, but you gotta look at data to see what are people dying from, what are these populations dying from, then raise up leaders to educate and teach and get them to connect. That's needed, and here again, advocacy in the area of policy. And then I'll put up there. So what can I do? There's a collective will. Remember in the early years how blacks and whites and all the community came together to provide what needed to be provided. We didn't look at color, we looked at need. This collective will is still very much needed today. Why not decrease health disparities by decreasing living disparities? See, the data I showed you earlier were people who had died, and this is what they died of. But we can do preventative things now in our community to decrease the living disparities. Each one, reach one prevention. Yes, we can. Where did I get that from? Okay, yes, we can. So here's some ideas, okay? And I'm gonna say that briefly. Don't you cut me off, Keenan. Okay, so lend your expertise to the Asheville Buncombe Institute of Parity Achievement. The executive director is here. Stand up, Joanna. So that they know how to, and they can further abstract and analyze data. What are people dying from? Where do we need to put our energies? What do we need? Make our resources more applicable in various areas to increase our footprint in Western North Carolina. Create community health ambassadors. This is a passion. We should be reporting to our leadership of city and county. City and county leadership should ask us, how are we doing on the health disparity report card? What are we doing as compared to last year? Ambassadors, that this is what they focus on and this is what they do, that it always stays in the forefront, that it does not become a misplaced priority. We've been in disparate conditions much too long. Healthcare Parity Achievement is a report card also for the Western North Carolina Medical Society. This is where the doctors are members of, the majority of doctors are members. Why not make this a part of their report card? How did you address disparities? What disparities are you seeing? Taking it to the streets, let's work beyond the walls. The Memphis model, and you can look it up online, Memphis, Tennessee did this. They created a hospital collaboration between faith communities in Memphis. The hospital hired navigators in the hospital, navigators, to work with community faith liaisons in various churches in Memphis, Tennessee. Whenever a person was admitted into the hospital from one of those congregations, that liaison contacted that navigator in the hospital. When that person was about to be discharged, that navigator made sure that person had the resources to get what they needed to connect the dots. And that liaison was notified when the person was discharged, and that is what happened to make it work. And they reduced health disparities significantly, reduced hospital readmissions, better managed charity care write-offs, and navigated individuals to more appropriate levels of care that they're not just showing up in the emergency departments. Very successful model. There are miles to go before we sleep, but I firmly believe that we can build our community as one of justice, compassion, trust, trustworthiness, and wholeness in Asheville, North Carolina. Thank you.